Hello and welcome to the program. I'm your host, Neal Howard. Thank you for joining us here on Health Professional Radio. Well, as people are attending graduations, as another school year winds down, folks are going to be going on vacation and, maybe camping trips. When you're dealing with chronic conditions such as allergic asthma, on top of everything that you've got planned, that's an additional challenge for kids and parents alike. Now, in recognition of National Asthma and Allergy Awareness Month, joining us today is Dr. Stanley Goldstein and Takeisha Smith. Dr. Goldstein is a board-certified in adult and pediatric allergy, asthma, and immunology. And Takeisha Smith is the mother of a child with allergic asthma. And they're here to discuss common allergic triggers and some of the symptoms and the importance of managing this condition in children especially. Welcome to the program, both Dr. Goldstein and Takeisha Smith.
Thank you.
Thank you.
Now, Dr. Goldstein, what is allergic asthma and how does it differ from the asthma that I've grown up my whole life hearing about?
So allergic asthma is a disease of the lungs, of the airways, where the airways become narrowed or swollen. But allergic asthma is created by an allergen exposure, specifically more common year-round allergens such as dust mite or animal dander that create allergic asthma, as opposed to non-allergic asthma, where that is not created by allergens, but stress, cold air, respiratory infection, pollutions can precipitate that. As far as how common, in adults, 24 million Americans in the United States have asthma. 60% of them are caused by allergic asthma. In children, more common, 6.3 million children in the United States have asthma. That's 1 in 12. And 80% of those children have allergic asthma.
Are there any different types of symptoms? I mean, if you grow up with a friend that has asthma, then you know, well, he's had it his whole life or whatever, but are there different symptoms between non-allergic and allergic conditions?
The symptoms wind up the exact same. However, what's important to be aware of, patients who may have allergic asthma know if they go into a household where there is a pet that they're allergic to, they may start feeling symptoms pretty soon, as soon as they walk into the house. Even often if the pet is not present or they don't even see the pet, they say, I know there's a cat or a dog in the environment. If they go down to their basements or attics or go underneath their beds looking for things where dust mites live very heartily, they'll also go down, have symptoms of cough, wheeze, and chest tightness. So it's what causes the symptoms. And any patient who has what's known as persistent asthma, ongoing symptoms of asthma, should be evaluated by all guidelines for allergic asthma. You're evaluated by doing either an allergy skin test or an allergy blood test looking at that specific allergen.
You mentioned the commonality in both adults and kids. Are the symptoms different or more severe or less severe in one class of patient as opposed to the other when it comes to age?
No, allergic asthma or non-allergic asthma symptoms are the same, and there are severities. But there's additional things you can do for allergic asthma. Avoid the allergens, taking the correct medications. Inhaled corticosteroids, one of the most common medications both for allergic and non-allergic, can reduce symptoms. However, if you have uncontrolled allergic asthma, implying I'm taking my medications, I'm removing those allergens from my environment, and you continue to have symptoms of allergic asthma, what else can I do? And there's something else that one can do, and that's what we're educating you today about during Asthma and Allergy and Awareness Month with Novartis and Genentech, talking about allergies and allergic asthma and the uncontrolled allergic asthmatic.
Okay, so differentiate between the two. You're taking your medications and it's still not controlled. What are some of these other things?
Okay, so the other thing that one could do, there's an additional medication called Xolair, which is indicated specifically for adults and children who have moderate to severe persistent asthma, and they continue to be uncontrolled. They continue to have symptoms of asthma despite taking their usual medications such as inhaled corticosteroids, and you have shown that these patients have an allergic cause for their asthma, either by doing an allergy blood test or doing an allergy skin test. If they have uncontrolled allergic asthma, despite that, additional medication, Xolair, can be used for them, and it's been shown to reduce asthma episodes.
Now, Takeisha, you've got a child that is dealing with allergic asthma. What were some of the things that tipped you off, or was it something that maybe you were told by someone else who noticed something in your kid?
Well, just like Dr. Goldstein was saying, she had the same symptoms as many kids that start out with asthma. She had the coughing, the wheezing, the chest tightness, and she would have these asthma episodes over and over again. And after many trips to the doctor, she finally saw an allergist who did a test to see what was going on with her, and then he diagnosed her with allergic asthma. And then that's how we found out that she had allergic asthma. Once we realized she had allergic asthma, we went through the house and got rid of the things that were triggers for her allergic asthma, the pet dander. So we got rid of the carpet and the fabric furniture, and we started washing her linens every week with hot water to treat the triggers that were causing her to have some of the episodes.
Now, you mentioned being properly diagnosed after several trips to the doctor. I'm assuming that one of those improper diagnoses may have been non-allergic asthma. Were there any other things that your daughter or your daughter's condition were called that turned out to be false as well?
Troy saw lots of doctors. Kids with asthma see lots of doctors and have lots of appointments. And so, that's why we're trying to educate parents about Allergy and Asthma Awareness Month, so that you can go to your doctor and advocate for your child, so that you can get information, so that you can know when you go into the doctor, this is what I'm being told, is this correct? So you can learn the right terminology, so that when you go into the doctor, you can explain, my kid has a runny nose, or my kid's coughing, I hear a funny sound, so that when you're in the doctor's office, you're using the right terminology, and you're asking the right questions, so that you can go in with correct information, so that, you aren't being told information that is inappropriate for your child. You are your child's advocate, and that's the whole point of this, to always be your child's advocate and to always listen to your child. That's what we do as parents. We advocate for our children and listen to our children. And if you are wanting more information on Asthma and Allergy Awareness Month, I encourage all parents to go out and look for that information, and you can find more information on Xolair on Xolair.com.
One of the important issues as you're answering that question is any patient, child or adult who has persistent asthma should be evaluated for allergies. That's based upon all guidelines, in the United States, international guidelines. Then, knowing whether that person has allergies or not, these are where treatments may separate. Typical medications, but then Xolair for that uncontrolled allergic asthmatic. And yes, more information is on the website, but be aware, just as we've spoken about how Xolair can decrease asthma episodes, you should be aware of a potential serious side effects known as anaphylaxis, which can be a severe life-threatening allergic reaction.
Great. Well, I thank you both for talking with us today, Dr. Goldstein and Takeisha Smith, here to raise awareness during Allergic Asthma Awareness Month. Thank you both for coming in today.
Thank you.